Hello. What would you think if you were, say, at work or maybe in a store, and all of a sudden someone became very upset and ran out of the room? Would you think that person had a psychological disorder? Well, most likely not. We could come up with a number of explanations for why someone might act that way. Yet we would probably acknowledge that that was unusual behavior in that particular situation. The process of determining if a person has a psychological disorder, the process of diagnosis, is one that requires careful consideration. And as you'll learn from reading the first chapter in your textbook, there are certain criteria that need to be present before a diagnosis of a psychological disorder would be made. Comer refers to these as the 4 Ds of psychological abnormality: deviance, distress, dysfunction, and danger. Deviance refers to something that's out of the ordinary, that's not normative. He doesn't mean deviance in the way that we might think about, say, a flasher being deviant. Of course, that person's behavior would be deviant, but here we're talking about any behavior that's out of the ordinary. And the example that I gave would be a kind of behavior that would probably be out of the ordinary in the situation that I just described. Yet we still would not be in a position to conclude that a person has a psychological disorder just based on that one behavior in the example that I shared. So something more needs to be going on before we might conclude that the individual has a psychological disorder. The second D is distress. And distress here refers mainly to psychological distress that a person would experience as a part of having a psychological disorder. Take someone who is suffering from an anxiety disorder, for example. That person is likely to experience a fair amount of distress on a daily basis because of the high level of anxiety they are likely going through. Of course, there are several different types of anxiety disorders, as we'll see soon when we get into that chapter. But let's just take panic disorder as an example. If you've ever had a panic attack, you know how scary it can be to not be able to breathe, to feel your heart racing, to be afraid you might be choking from not getting enough air, to be concerned that you might be having a heart attack, that you might die, or that you might be losing your mind. Panic attack is a very terrifying experience to have. And if someone were experiencing panic attacks, that would definitely be an example of distress. Or take someone who is suffering from depression. The depth of their sadness, their darkness, is more than we might be able to imagine if we've never actually experienced clinical depression before. One person described it as feeling like they had bricks tied to their back and they were in the water trying to swim. But when people are depressed, they oftentimes feel a profound sadness. They are unable to get themselves going in the morning. They don't take good care of themselves. They withdraw from other people. They may be racked with guilt. They may have serious thoughts of suicide. They're in tremendous psychological pain, in other words. And that would definitely be another example of distress. Dysfunction is the third of the 4 Ds of psychological abnormality. And of course, this refers to the extent to which a person's symptoms is interfering with their ability to function normally on a day-to-day basis. Take someone who's depressed again. Let's say it's a young mother and she has a job and she has children that she's caring for and a husband, and she's finding it increasingly difficult for her to be able to just do the things that she ordinarily does on a day-to-day basis. She may have trouble sleeping at night, and therefore she feels tired during the day. She may be more irritable, making it harder for her to have patience with her children. She may not be functioning as well at work. Students who become depressed oftentimes stop going to class and they can't concentrate and focus on their studies. These would all be examples of dysfunction that a person might experience when they are dealing with a psychological disorder. And the fourth of the Ds is danger. And this, of course, has to do with the extent to which a person might be a danger to him or herself or others. Of course, many people experience psychological disorders without danger being present, but sometimes it is. So, in considering whether or not a person is dealing with a psychological disorder, we need to take a look at these 4 Ds. And as we'll see when we get into a discussion of the various disorders, there are certain criteria that need to be met before a particular diagnosis would be made. We'll also be considering the downside of diagnosis as far as how it may affect in a negative way how a person would feel about him or herself, and set up a self-fulfilling prophecy situation where they may actually begin to think about themselves, feel about themselves differently, and maybe even act differently once a diagnosis has been made. Of course, there's an upside to diagnosis. When it's made correctly and accurately, it can help enhance understanding on the part of the clinician and the client, and help to advance the treatment process. So we'll explore these particular issues later. But for now, let's just leave it at looking at the 4 Ds of disorder. So there's a very fascinating discussion in the first chapter of Comer about the history of how psychological disorders have been considered. Now would be the best time in all of history for a person to have a psychological disorder, because so much more is known about the causes of disorders and their treatment than ever before. And fortunately, there are many effective treatments available, both biological and psychological treatments for psychological disorders. And there are many well-qualified professionals out there who are willing to help us with psychological disorders. Some of you taking this class will probably be one of those helpful professionals one day, and you will be in a position to make a big difference in the lives of countless people. If you go on to graduate school and become a licensed professional who is in a position to help people at that level with psychological disorders. But in the early days, going way back to the Stone Ages, one of the things that apparently was done to help people with well, help in quotes, people with psychological disorders, was to perform a surgical procedure, and I'll put that surgical in quotes, where holes were made in the skull of the individual. And do you know what the rationale was for that? To let out the evil spirits that were believed to inhabit that person's body, causing them to behave in an unusual way. Now, when we look back on that technique that's called trephination, Trephination, it does seem very barbaric to us. And of course, it was barbaric, but it was all people knew at that time. The idea about demon possession and psychological disorders is a fascinating one that was present off and on for hundreds of years, as people early on used to believe that it was demons that caused psychological disorders to occur. And then around the time of 3 to 500 BC, the early Greeks and Romans began to think about psychological disorders in a more humane kind of way, and believed that it was probably due to some sort of imbalance physiologically within the body of the person and in their lives as well. Hippocrates, for example, believed that we had 4 bodily humors that were out of balance that caused people to have psychological disorders. Well, nowadays we know it's not bodily humors, but neurotransmitters do seem to get out of balance in association with different psychological disorders, so he was on the right track. But hundreds of years after that, throughout Europe, people again used to believe that individuals with psychological disorders suffered from demon possession. And it wasn't until probably around the 16th century or so that some people were beginning to look more for biological causes for psychological disorders again. And as you read about this history in your book, you'll appreciate that there were certain individuals who began to look, hoping to find physical causes for specific psychological disorders, with the idea that, like with physical disorders, if you could find a specific cause, you could find a specific treatment and cure the person of that disorder. Well, now we know that it's not that simple, that psychological disorders are always caused by more than just one thing. While biological factors do play an important role in many disorders, the psychological factors and sociocultural factors also are important. So the search for biological causes of disorders continues to this day and has provided a lot of useful information on helping us to understand and treat psychological disorders, but we now know that there's a lot more to it than that as well. But those early efforts to find specific physical causes for psychological disorders eventually led to what's called the somatogenic perspective on psychological disorders, described in the first chapter of Comer. And of course, the word soma means body. So this is looking for physiological explanations for psychological disorders, is what the somatogenic perspective is all about. Another important historical perspective that occurred in the 17th to 19th century, around in that particular period of time, was what's called the psychogenic perspective on psychological disorders. And this was looking for psychological explanations for the development of disorders. And of course, one individual who's been very influential in the early days in looking for psychological explanations for disorders was Sigmund Freud, who was in the 19th and early 20th centuries. And we'll be talking about him some more later. But the developments that led up to Freud are also fascinating to learn about. And you'll have a chance to explore that history in Chapter 1, looking at the section on the psychogenic perspective, on psychological disorders. Another topic that's discussed in the first chapter that I wanted to have a chance to talk with you about a little bit is the section on research methods. When we think about psychopathology, we can consider that there are some people who mainly are researchers, and they're trying to understand causes and treatments of disorders, and there are other people who are mainly clinicians who use this information in an effort to try to help clients. And of course, there are some people who are both researchers and clinicians. But there's a good discussion in our first chapter about some of the main research methods that are used to try to gain a better understanding of the causes of psychological disorders and ways to help people with respect to treatment. So I wanted to talk with you about that a little bit, looking at some of the research methods that have been used and that are currently used in the exploration of psychopathology. One of the methods that's discussed in your chapter is the case study. As you probably are aware, a case study is an in-depth examination of one person. The case studies have been published for hundreds of years, really, in exploring particularly interesting cases and what clinicians discovered in assessing and treating a particular patient or client. Sigmund Freud, who developed psychoanalysis, he used the case study exclusively in his method of trying to gain a better understanding of our psychological nature and how our personalities develop and the causes and treatments of psychological disorders. In fact, the most famous case study in all of psychiatric literature is the case of Anna O, who was treated by Freud's mentor, Joseph Breuer. Anna, that's not her actual name, took care of her father when he was ill and dying. And it was quite traumatic for her. And after this experience in her life, she began to develop paralysis and numbness in the upper part of her body. So at that time, Breuer and Freud were experimenting with hypnosis, and they used hypnosis on Anna. And while under hypnosis, she expressed painful feelings associated with her experience with her father, and her physical symptoms lessened. One of the disadvantages of a case study, of course, is that you can't really generalize the results to other people because it's only one person that has been studied. So other research methods often involve larger groups of people in an effort to be able to generalize the findings to a larger population. Another research method that is used is what's called correlation. And as you may know already, correlation is when you look at the extent to which two variables are associated with each other. Let's say, for example, that someone did a correlational study where they were looking at the relationship between depression and self-esteem in teenagers. And they found, as we might expect, that the more depressed teenagers were, the lower was their self-esteem. That would be an example of a correlational study. And in this particular example, where one variable is increasing, depression, while the other variable is decreasing, self-esteem, would that be a positive correlation or a negative correlation? Well, you're right, it's a negative correlation because as one variable is increasing, the other variable is decreasing. In the case of a positive correlation, both variables are moving in the same direction. Either they're both increasing or both decreasing. Correlational studies are quite valuable, but one of the things they cannot tell us is if one variable is causing another variable. They can only let us know if there's an association between two variables. And when we think about our example of depression and self-esteem, we could probably think of other variables that might affect both depression and self-esteem that aren't being looked at in that particular study. And that's one of the reasons why a correlational study really cannot determine a cause-effect relationship, because there are always other variables that might be affecting both of the variables that you're studying. So think for a moment about other variables that might affect both depression and self-esteem. Some that come to mind for me would be the level of stress that might be going on in a person's life, whether or not they might be using drugs would be another example. Their genetic makeup would yet be another. And you could probably think of other variables that might affect both depression and self-esteem. The one type of research study that is capable of determining causation, a cause-effect relationship, of course, is an experiment. An experiment always starts out with a hypothesis that a researcher wants to test. And the researcher identifies some independent variable they're going to study to see how it affects another variable that would be the dependent variable. An easy way of thinking about an experiment would be to consider a study that would be looking at the effect of a new drug on depression. Let's say that you've developed a new drug and you want to determine if that drug could be helpful in the treatment of depressed adults. So think for a moment about how you would set up a study like that in order to explore whether or not your new drug would help people who are depressed. So we would need to gather up a group of people who are depressed. We would need to have a way of measuring depression so we could assess their level of depression. And we would randomly assign them to two groups: an experimental group, that would be the treatment group, and a control group. In this example, we would want to give them a placebo. And we would randomly assign them to groups as a way of trying to control for other variables that might affect the results. There could still be other variables that would affect the results, but if we randomly assign them, the idea there is that those effects would hopefully cancel out. So one group would get the drug and the other group would get the placebo, and we would be measuring depression and looking for changes in depression through our study. And our hypothesis would be that those participants who took the drug would show more improvement in depression than those who got a placebo. Of course, we would want to use a placebo because sometimes in these kinds of studies, the placebo effect can be as high as 60%. 60%. Because if people expect to get better, oftentimes they do get better. So in our study, what would be the independent variable? The variable we're manipulating to determine if it affects the other variable. Yes, the independent variable would be the drug, and the other variable, the one we're observing or measuring and are trying to influence through the independent variable, would be depression. As you'll see in reading about research methods in Chapter 1, there are a few others that are also available that researchers might use, but these three, case studies, correlation, and experiments, are the main ones I wanted to make sure that we had a chance to take a look at and that we all have a good understanding of. I guess that's about all for now, and I look forward to talking with you again soon.